Hello, I'm Dr. Greg Maguire. I wanted to give you an update on COVID-19. I had previously done a video back in February. I know a number of us scientists were warning that the pandemic was coming to the US in a very bad way back in January and February. 6 months later now, we're deep into the COVID-19 pandemic here in the US, with little progress having been made to quell this disease. So I want to go through a little bit about this so far never-ending pandemic that we've seen prosper throughout the world for the last 6 months and really become exacerbated here in the US. I'm going to share a couple of screenshots here so we can better go through this. So again, I wanted to update you on the SARS-CoV-2 virus, the virus that's causing the current COVID-19 disease pandemic. This is as of 7th of July 2020. Showing you a picture of the SARS-CoV-2 virus down at the bottom left of the screen. That's a electron micrograph of the SARS-CoV-2 virus, a group of them exiting a cell. In this case, the virus is pseudo-colored. The proteins are colored differently because the visual system sees color contrast vividly. That gives you a better view of the different components of the virus, including, if you look at the outside rim of each of those four virus particles, you can see in kind of the bluish green, you can see the little spikes coming off the virus. Those are the spike proteins. The proteins that I showed you in the last video back in February that allow the SARS-CoV-2 virus to recognize the host cells, the cells in you, and then attach to various cells within the body. So that's what you're seeing here. These virus particles in the electron micrograph were taken at the National Institutes of Allergy and Infectious Disease at the NIH near Washington, D.C. I do have published in April a paper that's free online. So it's about better preventing and mitigating the effects of COVID-19. Again, this paper is in a peer-reviewed science journal. It was reviewed by scientists and physicians. It is PubMed listed, so it's quite a good article. It's for free. You can find it if you Google Greg Maguire, Better Preventing and Mitigating the Effects of COVID-19. Google that, the paper will come up. And if you wish, you can read the whole thing or parts of it. And it is free. It will go through some of the things you can do as an individual to prevent the infection of the SARS-CoV-2 virus. And also, if you do become infected and you're showing signs of COVID-19, this has some of the things you can do to better mitigate the effects of COVID-19. This includes diet. If you're eating a diet full of fruits and vegetables and a lot of fiber, both soluble and insoluble fiber, you can actually quell inflammation, including in your upper respiratory tracts as well as the lower respiratory tracts and the lungs, and better prevent the virus from infecting you. Also, quelling the inflammation and upregulating your immune system will allow you to better fight the COVID-19 disease. As many of you know, and I talked about it previously, a lot of the injury and death in COVID-19 is due to a very high pro-inflammatory response, your immune system responding to the virus, causing a lot of inflammation, and therefore destruction of a lot of your tissues, including your lung tissue, causing fibrosis, a lot of effects, which a little bit I'll go over. But if you eat well, including lots of fruits and vegetables, a lot of fiber, limit the fat intake, just rid yourself of processed oils, including olive oils, coconut oils especially, MCTs, don't eat fatty foods. That includes fatty meats and cheeses, fatty fish. A lot of that will not only drop your immune response to this virus, but it also induces inflammation. So you can more easily contract these infectious diseases if you're in an inflamed state. Also, smoking, of course, too much drinking also inflames the upper respiratory tracts and sets you up for more infection. So try to be healthy. It's one of the things you can do. Of course, the thing that is most important is following public health guidelines. So socially distancing from people, not going into crowded rooms, not lingering in crowds. If you are around people, wear the mask. This whole idea of wearing a mask tramples my civil liberties is a bunch of jazz. We do things to protect ourselves in the community all the time. Wearing seatbelts in your car and an airplane, that's not trampling on your civil rights, people. Go wear a mask if you're going to be among people. Just use your head and don't follow these inflamed people, including at the top of the administration, who have no regard for your health or your welfare. Absolutely no regard. All they care about is money and power. So wear your mask and socially distance. It's the best thing you can do. Also take care of your health. I go into all of this in very great detail in my book. This one's not for free. It's available online at Amazon as well as Smashwords. You can find it in electronic format, and the paper format is only available at Amazon. It's a book about how to maintain your health, how to avoid having to be put into the dangerous medical system that we have in the U.S., how not to be overtreated, overdiagnosed, how not to in the first place become sick and have to seek medical care. Because as I explain in the paper, in the book, in particular related to infectious disease, the places where you're going to most likely catch an infectious disease are at healthcare facilities. This includes hospitals, clinics, nursing homes in particular. They're notorious for spreading infectious disease. You don't want to have to go into the clinic or the hospital. If you're put into that facility, especially with the lack of proper PPE, the overcrowding, the makeshift ICU units. Also, another big problem is inexperienced physicians working on you. They don't know how to intubate you correctly. When they do intubate, God forbid you have to do that, the virus particles are flying through the room. They're concentrating. They're doing a lot of medical procedures that they shouldn't. This is coming out in the literature now. We had warned you about this previously. They're going to over-intubate people. Indeed, that's what they've been doing, trying a lot of different drugs on people that don't work and only do harm, and actually bring the immune system down in response to the SARS-CoV-2 virus. So you really want to do everything you can to avoid physicians in this time, and they have enough to do without this pandemic, and avoid the hospitals, the clinics, and the nursing homes are still, a lot of them are in bad shape to try and prevent and mitigate this COVID-19 disease. So do everything you can to prevent yourself from becoming sick. So let me remind you that the United States is still in the first wave. We've never brought the infection curve rate back to baseline like other countries have done. So if you look here at the graph on the left side, that's the daily confirmed COVID-19 cases per million. So you can see the United States there in green. The rates went up quickly. That's the daily infections with COVID-19, the SARS-CoV-2 virus. The curve never came back down anywhere near baseline. It flattened out a bit for a couple of months. And then people became lax, and a lot of the country just became fatigued with COVID-19, and they let go of the regulations that were preventing, started opening up too soon. People weren't wearing masks or stopped wearing masks. They stopped socially distancing, and boom, that curve is way up now. Unlike countries, you can see there, kind of at the bottom of the screen is a little blip. Those are the daily infection rates for South Korea. As you can see, in late February, early March, South Korea had a rising number of cases of COVID-19 through good leadership from the top on down, very good public health response. They were able to bring the COVID-19 daily infection rate back down to baseline very quickly. They never had to do a close down, a lockdown of their society. Why? Because of strict public health measures from the president on down in South Korea. They quickly instituted public health measures, including testing, recognizing that there were outbreaks of COVID-19, identifying the people who had the disease, and then isolating those people. So they took it very seriously, very early on. They brought the curve back down to baseline. They never had to do a lockdown. Their industries, their society is open for business. Their economy is down because of the rest of the world's economy is down. So they're not selling and offering, various services to the United States and other countries. So their economy is down, but they never locked down South Korea. They took it very seriously. So they currently have a daily rate of COVID-19 infection of something on the order of 50 people a day. So they spot the people, they test them, they isolate them, and they've controlled their infection rate. Now, there was a nice study that I show here on the right side, and it illustrates what public health measures have done for the world up until the last couple of months. So this paper was published a week or two ago as a University of California group that did a study of public health measures over the first few months of the COVID-19 pandemic. And basically what they showed was 500 million or so infections were prevented worldwide by public health measures. So that means 500 million people not infected, and many people therefore are not maimed by the disease. And if you figure a death rate of, say, 1%, then 5 million lives have been saved through public health measures thus far. So pretty outstanding what public health measures have done for the world when you take it seriously, socially distance, wear your masks, isolate if you're infected. We can really control this disease. So I want to express for you that just because you have an asymptomatic case of COVID-19 infection doesn't mean you don't have morbidities. So when people say, oh, they're infected and nothing's happening to them, they're asymptomatic. What they mean by asymptomatic is that that person isn't experiencing fever, cough, or labored breathing. Those are the symptoms that people are saying are the outward displaying measures of COVID-19. If you don't have that, you're asymptomatic. Well, it's just not so, because what's happening with a COVID-19 infection with a lot of people, they're expressing morbidities that they're unaware of. So, for example, you take these so-called asymptomatic infected people with COVID-19 and you image the lungs, and what do you find? You find these so-called glass opacities in the lung. It's tissue going through a transformation, and potentially this tissue is becoming fibrotic. That means your lungs may be scarring. That's what it probably means. And this scarred tissue may last for months, years, potentially for the rest of your life. So we haven't done a lot of studies on that, but what's happening with a lot of people that are so-called asymptomatic COVID-19 infected people is that when you look closely in the lungs, you look in the arteries, you look at the blood, that, for example, the blood proteins are thrown off. The complement that we call it is thrown off. You have a high level of clotting factors, and it's blocking probably small arteries. So you may be causing lack of oxygen and potentially even microstrokes. Now, people with symptoms, their blood is clotting, and they're actually having large arteries clogged, and it's causing major stroke, heart attack. There's kidney failure. So there's a lot of problems with this disease, whether you're symptomatic or even asymptomatic. The disease is causing a lot of different morbidities, including heart attack, including major stroke, including kidney failure. Now, even in some of the young children, an expression of the blood vessels becoming clogged and damaged is something called COVID-toes. So physicians are seeing in the clinic now that even a lot of children have these darkened toes. And it's a reflection of the blood vessels becoming clogged and damaged. And therefore, you're seeing the darkened heme in the extremities in our tissues. So I want to reiterate, you see daily infection rates, and you see daily death rates. But what is not being systematically collected in terms of COVID-19 data are the morbidities. How many people are being maimed by this disease, and for how long will they be maimed? Will it be months, years, or a lifetime? Those data are not being systematically collected. So don't lead yourself astray if you see, yes, COVID-19 daily infection rates are going up, but death rates are going down. Because a lot of people, even if they don't die, they're being maimed, again, potentially for a very long time. So this is part of the problem with COVID-19. It's not like the flu. A lot of people are being severely maimed. It's not reflected in the statistics. So something going on out there that you may have heard of is that the SARS-CoV-2 virus has mutated. So you can see the SARS-CoV-2 virus down in the bottom left. Virus basically is a round ball with these spike proteins. So the red kind of spikes coming out of the round ball, those are the spike proteins. And what scientists have found out, some of the work done here at the University of California, San Diego, and one of the allergy infectious disease institutes here in La Jolla, has recently discovered, and this group was at the University of California, one of the national labs, found out that in these viruses, the RNA in this case mutates. And as it mutates, the virus may or may not change the protein structure given a mutation, but some of the mutations do cause protein structure change, and those protein structure changes sometimes result in a different phenotype or a different variant of the virus that actually has different characteristics. So if the mutation in the virus causes a protein change that gives it a functionally different characteristic, then that will be called a variant. And so they found a variant that is becoming dominant in many places in the world. And this variant has a change in the spike structure. The spike protein structure has changed. What they're finding is that this new variant infects more cells. And so they do that in the laboratory. They put the virus in a dish and they look at the different cell types that are infected, and they're finding the cells are more easily infected. They're also finding when they look in patients, they can look at the RNA structure samples in the patients. What they're finding is in the respiratory tracts with this new variant, there's a higher titer of the virus. So you have more virus in you with this new variant. So what this means in the long term, we don't know for sure, but it may mean that the virus is more easily transmitted. It may mean that you are infected more easily, become a COVID-19 patient more easily. It may not mean that once you have the disease, it's more severe. It's that you have a higher probability of catching the disease and a higher probability of having a severe disease. It may not mean that the disease is more severe, just the probability of catching a disease or the disease becoming more severe is higher. So all of this is being actively studied, and the key here is we don't know a lot about this virus or this disease yet. We've learned a lot, but there's a lot more to learn. It's very actively being studied. After all, we've only had this virus in humans, recognized in humans, for about 6 months. So there's a lot to be learned. Also, you've heard a lot about the airborne transmission. So we know that the SARS-CoV-2 virus, when we cough, these droplets go out and they actually spread. So this was a study there on the left done at MIT years ago, 2014, I believe, just showing when you cough, these particles travel much farther than you might imagine. This 6-foot distance between people, that won't separate you from the particles that come out in a cough or a sneeze, not by a long shot. So these particles really do travel. It's been thought that the most transmissible form of the virus particles is when they're in these droplets. So when these droplets go out from the cough, the sneeze, or someone yelling at you in the store that they don't want to wear a mask, they're shooting out a lot of particles. And so the droplets can spray onto you, but the droplets are not an aerosol. They fall more quickly than do the aerosol particles. And so if you have particles in an aerosol, they really hang in the air for a long time, and they can travel farther if you're in a non-vented room or a room that's poorly vented, and you have one or more people talking, singing, whatever it is, these particles being aerosolized out into the room, then they can hang in the room, and if you're in there for some period of time, then you're breathing them in. So even if it's a lesser dose and they're in the aerosol content of the air, it's a lesser dose, but you're breathing it in over a long period of time, then you can have an increased probability of infection. So that's why they're wanting you, if you go to a restaurant, eat outside, where you have a larger volume of air, it's well stirred, and the viral particles will disperse. So this is something that's being studied. Of course, if you have a mask on, that cough will not go out so greatly. It tends to come out of the mask around you, not spread so far. You have less of the aerosol product going out. So if you're wearing a mask, less going out. And then if you're wearing a mask, then decreased probability of it coming in. Now, these cloth masks that most people are wearing have not been studied directly. So other mask types have, and they do control it. The cloth masks probably do control it to some extent. Definitely better than nothing. And if you have someone who has the COVID-19 and is spraying it, has a mask, you're controlling it that way. And then if you have a mask on and you're the receiver, both ways you're decreasing the probability of exposure and infection. So you definitely want to socially distance and wear the mask. It's the best thing we have to prevent and control this disease. So just to remind you, these particles, these viral particles are very teeny tiny. We know from studies that PM 2.5 particulate matter of 2.5 microns that will travel all the way down into the lungs, actually into the alveoli sacs. So those are little sacs in the lung where gas exchange occurs, where oxygen comes in, CO2 goes out. These virus particles are smaller than 2.5 microns. They're about 0.14 microns in diameter. And that means these viral particles potentially, they're taken in, they can go all the way down into the lungs and into the alveoli, where they then attach to the ACE2 receptors and infect your cells. Just as a note, if you've ever been around someone that's, say, eating garlic or onion, and you're close enough to them to smell the garlic or the onion as they talk, then you're breathing in, you're experiencing breathing in particulate matter. So those are volatile substance. It's a little different, but it gives you an idea. So if you're close to someone, you're breathing in these particles, and you're doing it in particular for some period of time, you're increasing your probability of infection. So we've been hearing a lot about antibodies. So I wanted to just mention to you that we don't yet know that if you've been infected with the SARS-CoV-2 virus and have had the COVID-19 disease, whether you're asymptomatic or symptomatic, we don't know whether the development of those antibodies will protect you or not. And in some diseases, the antibodies do not protect you. So up in figure 1A, you can see it up in the top left there. You can see in this case, we're showing a cartoon where your body has been infected. Your beta cells are making these antibodies. So it's part of your adaptive immune system. And what happens is, once the immune system has recognized the virus or any other pathogen, part of what happens is that the pathogen is presented to adaptive immune cells, and including the beta cells. And the beta cells will then make antibodies based on the structure of the proteins in the pathogen, SARS-CoV-2 virus. And they'll make these hopefully make these very specific antibodies that then recognize the virus. So they've been presented proteins from the virus, they recognize it, then they start making protein antibodies that fit into the viral proteins. And they send them out into your blood supply to then go, these antibodies, these hopefully neutralizing antibodies, then go through your bloodstream and attack the virus. And these neutralizing antibodies that your beta cells make fit onto those spike proteins that I showed you. And they prevent the virus from gaining entry into your cells, so that the neutralizing antibodies prevent that SARS-CoV-2 virus from attaching to those ACE2 receptors and then going through a process where they gain entry. Well, this doesn't happen all the time. So in some diseases like dengue fever, and for older people, it's harder to make the quantity, and we think in some cases the quality of these neutralizing antibodies. And sometimes what you're making to an infection, to a pathogen, are non-neutralizing antibodies. So these are antibodies that, yes, they attach to the virus, but they don't prevent it from gaining entry. They actually can facilitate entry of virus into some of your cells, including your immune cells. Now, when these non-neutralizing antibodies facilitate the virus coming into your cells, this can happen to macrophages, part of your innate immune system that fight the virus. But what happens is, if the macrophage has the virus inside of it with these non-neutralizing antibodies, the evidence suggests that the virus won't replicate itself, but what it does, the virus does, it causes a lot of inflammatory proteins to be made. These pro-inflammatory cytokines you can see on the lower right are made, and this causes a huge inflammatory response in your body. And as I told you, this is part of what can kill you or maim you, is the inflammation in your body. Chronic, unresolved inflammation is a major destroyer of tissues. This will damage the lungs, the blood vessels, the heart, you name it throughout the body. If you have a lot of inflammation, it will destroy tissues. So this is part of what's happening with the SARS-CoV-2 infection. And we do have the potential that the antibodies that are being made, either naturally, so through an infection, the antibodies may not be preventing future infections, and the antibodies can be causing inflammation. Furthermore, if you have a vaccination that is not made well, and the vaccine causes the production of these non-neutralizing antibodies, but not properly making the neutralizing antibodies, then the vaccine can do more harm than good. So that's why these vaccines are very difficult to make. They require a lot of time and a lot of research to be made correctly. The vaccine that I just had for shingles, so it's the newer shingles vaccine. It's 97 point something effective in older people, 55 and plus. It's hard to make vaccines. It's harder to make vaccines for older people. We have a degraded adaptive immune system, but through 10 years of work, you heard me, 10 years of work, scientists were able to make a proper vaccine for older people who were highly afflicted with shingles. And they made a shingles vaccine that was over 97% effective, people 55 years of age or older. So 10 years of work. So it's not easy to make a vaccine. So the idea that we're going to have a vaccine in 18 months, maybe. Scientists are working very hard on it, including some people I know. They're very good, very senior scientists and very sincere in what they're doing. They're hard at work, but They tell me it's a stretch to be able to make one that's effective, safe, and effective in 18 months. Then a big problem with some vaccines, even if the vaccine in theory and in practice is good, if it's not manufactured well, then it becomes a big problem. So a lot of these vaccines are made overseas in India and China, and the manufacturing processes over there in general are horrible. They're very, especially in India, highly unregulated. Whenever I have a vaccine, I tell the person, give me the vaccine that I want to see, vaccine insert. I want to see how it was made, by what company, and in what country. And if the vaccine is made in India and China, I tell them no way. And I will go elsewhere to have my vaccine, where they have sourced it from Western Europe, the United States, Japan, countries like this, where they have good regulations. Even here we have problems, but we have much greater regulation. So these are some of the updates we have as of July 2020. And if anything new and exciting comes about, I will be the first to let you know. So thank you for your attention, and please safeguard yourself, eat well, sleep well, don't drink too much, don't smoke, eat those fruits and vegetables and lots of fiber, and socially distance. If you have to go out for those things that you must do, like grocery shopping, be careful where you go. Don't go into places where they're not careful to shield people and keep people at a distance. And by all means, wear your mask. Be safe. Bye-bye.